Thank you, Dr. Sham, for that wonderful introduction. So I think now we can move into the panel discussion. Yeah, so like Dr. Sham mentioned, healthcare is changing. There are a lot more factors involved. Like traditionally, it was just an interaction between a patient and a doctor, but that soon changed into um, real estate became a factor with hospitals being built. And then after that, there was brands and marketing, like the traditional marketing. And then during the COVID era, that changed even more. Um, so technology and digital marketing started becoming way more necessary and important. So with all of that, we can say that technology can enable experiences but not replace hands-on human expertise. So Professor Shubhanarayan sir, if you could share your thoughts on this, it would be great.
Hello. Yeah. Thank you for the question. I would start my talk as a doctor perspective because I happen to be a medical student. So I remember in my medical school days when a investigation was done for a patient, we used to run around, get the investigation data and come to the patient and tell something. I remember how much we are walking every day, minimum 5 kilometers just for this reason. So now coming to this stage, when I go to hospital now, not only the investigations are given by WhatsApp, even patients do not go out of their house actually. So what I understand, technology is the enabler for assessing of the healthcare to every patient very easily, and let us all accept that. And the best word would be as doctors, maybe you, not me, but as doctors, you should adjust, adapt, and evolve with the situation. So, of course, many things are now changing. Doctors need to adapt, and there are some outdated technology or something is there. It need to be actually upgraded. But at the same time, I must say the direct experience of a patient, what he or she feels with a doctor, that cannot be taken out. So we know now many patients they go from one doctor to another doctor just for second, third, fourth consultation without understanding the without getting the empathy from the doctor. So once they get that empathy, I feel all doctors understand that how the patients stick to them. Even sometimes they do a bad decision, they stick to them because that personal connection is very vital. I don't think that will technology can enable. So in a way, technology can make the assessing of the healthcare and other things easier. However, the hands-on experience or direct experience is a must. That's what I will say. Thank you.
Thank you, sir. That was very insightful. Professor Deva Priyakumar, sir, if you could add on to that.
Yeah, thank you, Chester. Thanks for having me. So, maybe I will, talk a little bit about what we do and the importance of data because in the morning, I was here by 10:30 or so, and there are several, speakers mentioned about how, data-driven technologies and artificial intelligence are kind of, at least we do see a potential in them making breakthrough in healthcare in general, right? So when we talk about AI or data-driven technologies for healthcare, there are several aspects. There was someone who mentioned about image-based diagnostics, right? Come up with solutions that takes images and then gives the clinical decisions or developing clinical decision support systems, based on different kinds of data, right? So in that sense, nothing is going to change in terms of how the healthcare actually is going to work. The doctors are actually going to face the patients. That's not going to change, right? But then when you have new technologies that come in, who is going to create these technologies and who is going to use these technologies and how it's going to kind of make an impact, right? So now we are at a situation, at least I even hear 2 years ago where people say that AI, even from medical practitioners, we say AI. I don't think so. There are several concerns, whether in terms of privacy or in terms of interpretability or fairness. or in terms of other, related, data related concerns. But that kind of, going away right now, because people are talking about it and trying to do something about it, right? The other aspect is the medical practitioners themselves are trying to be part of these things. Like for example, some of the projects we do, we work with NIMS, Tata Memorial, and then Homi Bhabha Research Institute, Grace Cancer Foundation, and several other hospitals and NGOs who are directly connected in the domain, right? So, and then we have scientists, data scientists and machine learning engineers who, work with us. And then there are other kind of engineers who try to put together, these solutions and trying to, put out products. And there was also mention of how does all this happen, because you need an ecosystem that has to support these things and bring to the market. I'm sure he will speak more about how these technologies can be brought to the market through startups and other aspects as well. So we are at a crossroads right now where there are several of these disciplines come together, right? So whether it's medical professionals or data scientists or other IT engineers, and then humanities and so on, right? So there is a crucial need for these people to come together, right? So if I sit together, with my students and engineers in the lab and then develop a technology and then go out and then say, hey, man, it works really nice, diagnostic tool, can you use it? No, doctors are not going to use it, right? So doctors have to be part of this, because they understand it well. The government has to be part of this so that the implementation can actually happen, right? And the policy interventions can happen and so on. So it's kind of a, it's absolutely necessary to have this potpourri of different kinds of people come together to come to create technologies that can actually be used, right? So maybe you can discuss further on this. Yeah.
Thank you. That was great. So basically, as useful as technology is, as helpful as it is, I think hands-on expertise is always necessary along with the technology that's being developed. Would any of the rest of you like to add on to this? We'd like to hear your thoughts as well. Or else we can move on to the next question. Okay, so yeah, like we just spoke about, as healthcare is ever changing, the healthcare is also seen as a business now. And of course, the government and the nation. So how would you say all these stakeholders play a role in healthcare industry? Mr. Rajesh Manthina, sir, if you could speak about this.
So, I mean, we've heard a lot of speakers today, and even on the panel today, one of the common themes we see is that, patient is at the center and, focusing on primary health, whether it's data, et cetera, how to make healthcare available, right? Accessible, affordable is the central theme, right? And, as you rightly said, in terms of stakeholders with patient in the middle, whether it's healthcare delivery, hospitals, clinics, etc. On the other side, manufacturers of devices or pharmaceutical industry, governments being involved, now startups. It's important that the goals are aligned. We've seen time and again that the intent is there whenever somebody actually comes. Whether it's a private player, government. We've seen the health minister talk eloquently about what the government is doing, which is very, very encouraging to see, right? Whether it's, creating pill packets and delivering it home, etc. I think the effort is there from everyone, but from a delivery perspective, as long as everybody kind of believes in it, that education happens, alignment is there in terms of, we're all working towards the same goal of, making that best healthcare available, accessible and affordable to the patient. It's difficult to create. I come from a, private healthcare delivery platform, right? So we create cancer centers in tier 2, tier 3 centers. The reason we create it in tier 2, tier 3 centers is to kind of solve that issue of, urban-rural divide, right? There is, a lot of focus on cities these days. We only have about 35% of the population living in cities, but 75% of the healthcare delivery happens in the cities. So there's sort of a inverse flip in terms of where the need is versus where the services are provided. So one way we're solving it is by actually going into tier tier 3 cities. Of course, it is difficult to, hire doctors there, make, quality care available at those prices. But again, to get back to your question of ecosystem, it's important that everybody is aligned and everybody is, and now about the startups, right? I'm also the vice chair of Hyderabad Angels. We see a lot of startups come in, and it's relevant. The topic today, I think we're sitting here and talking about disruption in healthcare. I think it's sort of a misnomer because healthcare has changed, is changing, but also has remained the same for the last 70, 100 years, right? So, thinking that somehow it's going to change, it's a traditional industry. We're, talking about medicine, emotion. So thinking that it'll somehow change in a day, when we think about disruption, you're thinking about, changing it in a day, month, year, right? I think it takes some time. So I think people, all the stakeholders involved, thinking that this is a long-term play, whether it's private or government, making sure that we all understand what is at stake, and making ourselves aligned to that long-term goals, I think is the right way to look at it.
Yeah, thank you, sir. That was great. Dr. Ashok Kumar Tiwari, sir, if you would like to add to that as well.
Thank you. Uh, in fact, I would say at the first outset that don't worry. There is no disruption. We have been moving, we will be moving, and we are moving. Technologies have changed. They have no doubt improved our lifestyle, ease of life, and ease of doing business, and so many things in every walk of our life. There is nothing to worry. Only thing is that we have to keep our eyes, ears open, and mind broad. We should not narrow our thinking. In Srimad Bhagavad Gita, I heard a professor from Osmania University was saying, Gandhi Hospital was saying we do pranayama, yoga, and other things. Now these words have become very common. They were lying in our classical textbooks. Now it has become global practice for lifestyle disease management. I am working in those areas. Dr. Prasad Rao is there. We are collaborating with that one. In Srimad Bhagavad Gita, Lord Krishna says, Sreyo hi jnanam. The best thing is that accumulate knowledge, have knowledge, go in search of knowledge. That is why Rig Veda had told, Ano bhadra karto yantu vishwatah. Anywhere in the world, any corner of this world, knowledge is available. Have that good knowledge. And today we are globalized, we are in information age. Just at a click of your fingertips, you are connected to the world and you are connected to the literature. As I said in my previous remarks, that things are changing. Did we ever knew that MRIs will come? X-ray will be replaced with portable things.
Healthcare which enables or facilitates the whole process of healthcare being on its purpose of service. So if we have to look at like a spectrum in a very crude way, on one side of the spectrum I see healthcare as a pure service, and on the other side of the spectrum, if we have to start looking at healthcare as a commercial business, then I would say balancing this on the spectrum is the art of healthcare, right? And I would confidently say that most of the doctors in this room would agree, because it is not purely a commercial business. There is, so if you have to put it in a right word, I would say healthcare is more like a responsive business, where without service, the business cannot exist, and without the business angle, the service cannot be facilitated. So striking the balance is the key. At least in the current digital era, it becomes more an essential ingredient of the healthcare. That's my opinion about it. Yeah.
Can I add on a very nice response, very useful for us? This is where we all struggle. Doctor community, the healthcare in India is very, very transactional. People have to pay for their consultation lab. There is the trust deficit is huge in India. In Western world, the insurances or government, the whole monetary component is bypassed. So this is where the conflict arises. And in India, the problem is there are different sections of people, the poor, middle class, rich. Their expectations are different. So always, now there are, whether it's diagnostics, medications, a middle class may not, middle class or low class may not afford what others may want to, So the other problem we have is these diagnostic chains, a pharmacy industry, they give for example, they give 20% discount. In traditional healthcare, what doctors traditionally we do is, for poor, we almost do free. Like for a type 1 diabetic, we provide insulin for free till they are 16. But we cannot sustain 20% discount across all sections. So this is where there is a lot of conflict, where we should strike the balance. To outside, it looks very good. So the perception problem is another big worry. Patients perceive as now the healthcare industry is not as respectful as it used to be, in yesteryears years. This is where the conflict is happening between doctor community and patients. And how to strike that balance is a very tricky element, because patient spectrum varies from rich, middle to poor.
Yeah, this is an interesting point, and let me add to what our friend just spoke. I mean, I completely agree that striking balance is not as easy as it is said. But today we are living in this digital era, right? Today we are talking about wearables, we are talking about real-time monitoring of patients. Now, the catch here is digital expensive to make healthcare more as a commercial business? Because when you put a digital layer over the healthcare processes or as a system, is it really becoming an expensive affair overall to provide it back to the beneficiary? Or is it trying to create a bottom line impact on a healthcare provider, which can be translated as a cost advantage, as an affordability benefit to the class of people whom we spoke about, the low or the middle class? So that is an important question to ponder. So connecting back to the theme of the technology per se, to this question and a good discussion that we're having, I would put it this way, that digital is an opportunity for us to gauge, to strike a balance between this spectrum. If we are able to leverage the digital technologies and pass on the cost advantage to the beneficiaries, there develops a new business model. And in fact, some of my research talking about digital health for the bottom of the pyramid addresses exactly this issue of balancing both the availability and the affordability for that class of people in our country who cannot see healthcare only as a transactional business, but lot more as a service which they can afford. So digital could be one way of looking or trying to solve this problem. But anyway, research has to answer these kind of questions, but this could be one way of looking at it. Yeah.
Hello. Yeah. See, I'm from Watson University, and I'm the program chair for MBA Business Analytics, where we have a center of excellence in the area of artificial intelligence and robotics. And it's been a collaboration with Ferret, J.J. Strassmayer, University of Osijek, Croatia, where we have a problem statement, especially how we can build an app, especially that app is mainly for all kind of peoples, where especially who have been suffering with diabetes and cholesterol problems. And the name which we assigned as of now is building of NLP model for diabetes patients. And what it will do is, you no need to go for any doctors or anything. Just if you have a blood report, if you scan it through your mobile, automatically it will detect the range of your the sugar level and your cholesterol level, and it will suggest you that it will do the yearly diagnosis also, and it will suggest you whether in future you will get the diabetes, or now you are in pre-diabetes or not, or if the cholesterol level is above 260, then you will be in a higher level of getting a heart attack disease, like that. One thing. Apart from that, those app will suggest you the diet plan too, where what kind of diet you should take based on the level of sugar level and cholesterol. The second thing. And the third thing is it will consult you where if the level is high, you just need to go to the doctor and meet. Morning when I'm listening to Harish Garu sir thing, that really it strikes that the government has been doing all those things, the BP level, and we're sending a message to all those peoples. So we when we look into it, that we are in a right way, I thought, and we are planning to launch this app. It's a free of cost for all of them, and everyone can utilize this. So this is what from my side we need to say when we all discussing about this business plan model. Thank you.
Yeah, maybe I'll just say a couple of things. Give a very different perspective. The stakeholder is not you, the stakeholder is not us, the stakeholder is actually the person and the patient and the public. I am worried, and this is my concern, is that we all talk about the industry being the stakeholder, the doctors being the stakeholder, then government is the stakeholder. The real stakeholder is the public whose health is at concern, which means all of us. So as long as you create models that take care of the stakeholder, your sustainability and your trust factor will always be high. As far as you think that you're the stakeholder or we are the stakeholder, our interests are largely going to be governed by how we can sustain our activities, not the ones that matter at the deliverables. The delivery is what is more important. The digitization and digital health, all of these are useful for us to gain access, but not necessarily to deliver. If you have to deliver, please create models where stakeholders are the patients and are the public and not the industry. Which is then you will make more sustainable models where you can probably strike the balance that he was talking about. Thank you.
Thank you, sir. Ravi Umar, sir, would you like to add anything to this? And according to you, what do you think is success in the healthcare industry?
Sure, thank you. I think the question actually revolves around, is it, when you say service, I think is a service a social service, or healthcare itself as a service, it's a business, right? End of the day, it is a business. Somebody's getting educated, paying fees to become a doctor, they're spending money, they're spending infrastructure to go build a hospital to provide that service. So when you talk about service, if it's social, that belongs to what, like our Honorable Minister talked this morning, right? It's in the purview of social welfare organizations or government, where government does provide exceptional service in India compared to most of the developed nations. Right? When you talk about service as a business, it is a business at the end of the day. Right? No other, we provide software services. Somebody coming to us, even though it's a service, is expected to pay for it. So that, as a separating healthcare into business and services, I think is not accurate portrayal of the business. It is a business at the end of the day. So, but the question is, with the advent of most WebMD doctors, right? What is the service that they want? Everybody who wants it. When government is providing a service, nobody wants to go there. At the same time, as Minister was mentioning, when medicine is provided to their doorstep because it's free, and there is a social service being provided, the adaptation is only 30%, right? But whereas if you go to an Apollo hospital or someplace, right, and that medicine, when it costs, people complain about cost. At the same time, it is more highly adapted and used. So I think for the industry, like all the people who are here as doctors, right? I'm not a doctor, but I think Professor there was mentioning the true stakeholder is actually the patient, right? If as a business, if the centricity of that business is around the patient, not around the hospital infrastructure cost or the economic bottom line, I think it will work itself out. Right? That's what I could say.
Thank you, sir. That was really insightful. Currently, NLP.
Could I just share my perspective? I just thought it's probably relevant. I spent the best part of a couple of decades out of India, and I recently came back to Hyderabad. And what I noticed is that in India, there are two different strata of people. What I mean by that is, when I first came to Hyderabad and roamed in Gachibowli area, I was like really gobsmacked at the amount of, the development and everything. But also later, when I went with our marketing guys to some of the inside places in Hyderabad, there are patients who are paying 50 rupees per consultation to an RMP doctor or somewhere. And mind you, the line there is huge. Like, I felt jealous at the number of patients that person is attracting. And none of the patients there had any idea of what these, the various things are. They don't have wearables, they don't have a smartphone. Maybe they do, but they don't have the apps. It's almost like whatever we are trying to do through the digital era and disruptive technologies, I'm not really convinced, at least at that point, of their penetration. Like, whatever we're trying to do is only reaching the strata of the people that are willing to have it, or they have the resources to have it. But really, the other part of the population, they have no idea what this is all about, and I don't know how to reach them. And also, maybe this is what they mean by the gap between the rich and the poor is growing in not only in America, in India as well. So I think it's important because the number of people in the other strata are huge, are humongous.
Thank you, sir.
Can I quickly respond to that? Yeah. Yeah, so that's a very valid point, right? But the one of the important questions that we should ask, I think, starting from the point whether it's a business or a service, right? Irrespective of what we are talking about, somebody is paying for that. It's either the government or the patient himself or the insurance company. Somebody is paying for that, right? So in that sense, there is a huge economy that kind of goes into this service, right? So coming back to saying, how do you handle, for example, the set of people, who possibly do not have access to this kind of technology? I think the question that we should ask is, how can technology help us take, healthcare solutions at the population scale, right? We don't put the onus on the patient to seek for that kind of technology to get that service, right? It's as Professor Ullas was saying, the patient is at the center, but as healthcare providers, what is it our contribution to take technology to maximize the number of people we reach and minimize possibly the costs associated with certain screening or diagnostics and so on, so that we democratize, right, or make the healthcare access to a larger population. I think that's the important question for us to ask. Yeah.
Thank you, sir. Currently, NLP and ML research focuses on areas like physicians' productivity, quality of care to improve patient experiences. Dr. Hemachandran, sir, what do you think NLP and ML research should focus on in the next 5 years?
Yes. If you see now, I read in one article in Times of India. In that, it is mentioned that from 2019 to 2025, the AI, especially in the healthcare sector, the CAGR level goes up to 51%. And how it has been happening is based upon data. If nowadays, if you see around 38 zettabytes data is being present in the cloud storage as along of the globe. But if you see in 2023, they are saying that around 200 plus zettabytes data will be there. So if you have that much of data in artificial intelligence sector, we can do a lot of wonders. The first thing. And second thing, recently I read one more article which has been published in Helion, where the professor name is Michael, and he is in the Department of Surgery and in the University of Hong Kong. Recently they developed one chatbot, especially using natural language processing. It's mainly for during the COVID situation, the undergraduate students of medical university can't able to see the cases, outpatients, we can say. So that there are a lot of drawbacks happened over there. So to train them, how we can train them? So what he had done, he created one chatbot where the chatbot will act like it will be pre-installed with case studies and a lot of case scenarios, so the students can access that and they can learn from their own, what is the problem. If it asks what is the problem, it will say that we have a breast cancer, like that. So what is the solution can be given, all those things, like the students can learn on their own. So this is a drawback when a COVID situation occurs, and they're given a solution by preparing building a chatbot with NLP, and they're given. So this is an advancement we can say. And another advancement we can say is nowadays, if you see, sir said that many of them are standing in a queue to meet the doctors. But in future, what will happen? There will be nothing like that. If you want to see a particular patient or a doctor, so what once you go fix an appointment, in the doctor table automatically the total report of that particular patient will be there, and by one click it totally get analyzed from the birth to till date, what has happened for him, and what are the diseases previously occurred, and what is the tablets has been taken. Everything will be analyzed, and just you will get a sample one page report, so that automatically you can analyze all the things. And finally, if the patient comes, you can just give a consultation, that's it. So no need to put that much of time in that. So this is what the advancement which I think. And in 2025, this combination of both natural language processing and machine learning will go higher, and much even the healthcare sector will grow higher with the help of this artificial intelligence. Thank you.
Thank you so much, sir, for your input. Hemat, Devapriya Kumar, sir, would you like to add anything?
No, I think, I respect, what is said, but, I think it's very, very ambitious and, it'll be nice. I mean, if you are at at that level, it'll be really nice, but I think it's very, very ambitious, yeah.
Let me add something to that. Again, respectful goal, and I think we'll get there, right? But in terms of where we are today, right, we have to be practical in terms of how the industry absorbs this, en masse, how we actually make it available as projects, as cool things to do. These things make sense, just to give you a couple, not to be negative on this, but if you think of, large guys getting into this, trying to use AI and chatbots, right? Watson is, IBM Watson is a big example. I think they spent about $5 billion, which is, I don't know how much is that in rupees, maybe 35,000 crores, right? They shut it down, I think 2 years ago, 3 years ago, right? After spending all that, they had 7,000 employees. I think Berkshire Hathaway, JP Morgan, and Amazon opened a company to kind of revolutionize healthcare and bring down the cost, right? They shut it down 2 years ago. I mean, there are large people involved. Microsoft has Health Vault. I mean, people are trying to solve the problem by using technology, etc. But, in reality, absorption has been slow, right? So, choosing our area, I think we can't solve it all in one go. It won't be a one size fit all. We all have to kind of choose our own area, make sure that, what we're delivering makes sense to the industry. Again, from a private player perspective, it is true that when Dr. Sham mentioned, healthcare has a, bad rap today, right? People actually have that mistrust saying, okay, unnecessary tests are done, or I'm spending more. But I also think from the industry side, there are a lot of healthcare providers that are struggling, right? Despite of the best intention, it is difficult for it as an industry to make it work, right? Of course, COVID is an exception. People did make merry, all that. But also, with the best of intention, whether it's real estate costs or cost of getting educated, all this, when you put it all together, right, it's a sort of a tricky industry on the private player side to make sense, right? So, we have to put our heads together. You can have the best of technology, you can have the best of people working on it, but, at the end of the day, it has to make sense even to provide it as a service, right? So, things have to be aligned.
Thank you, sir.
Sorry, can I just ask? No, thank you very much for that. That we are going into new technologies and um, you know, maybe a chat, a bot diagnosing something, or giving the advice as well. I mean, in this context, actually, I would like to ask Rakesh Kumar Sahai sir. Sahai sir, we are talking about, the latest technology and a bot diagnosing things. But traditionally, a doctor and as we learned a lot of clinical skills, and we need that. The moment you look at the patient physically, and then you have so much to talk about it, and then you don't even touch, but the look at it, and then you get a diagnosis in most of the cases, and that is how we were traditionally taught. So what do you think in the future, sir? I mean, is it going to be the future students are going to be less clinically skilled, or I would like you to comment on this, sir, because you're a teacher. I would like you to.
So I think when we started off, Dr. Subha said that he was saying that although all this technology is going to come in, but that the empathy and the patient contact which you make, that makes a lot of difference, and that's what he, I think, put it very rightly in the opening statement of his when we started this discussion. So I think that still holds good, that whatever technology comes, I think that part will still remain. And many a times we also see that, I mean, in today's age, when we see a lot of people going through Google and reading about many things and coming to you, they sometimes miss the most important point, which you pick up by just looking at them or just having a word with them. So I think that's what makes the difference, and that part will always remain. While technology may help you in reaching out to more people and probably making a difference in terms of making it simple for them to access you, or or get information or something like that. But I think that part will certainly remain.
Thank you, sir.
As we know, research and innovation are important components of healthcare. As of now, the responsibility of this mainly lies with the academicians and the pharma industry. So do you think there should be more input from other sources like the other doctors and the government? If so, how can we make this research more collaborative? I would like to direct this to Professor Ullas, sir.
Yeah. So, of course, I'll go back to what I said. Pharma and the doctors, mostly because of the sustainability model, the research is largely aimed at solving a problem after the problem has surfaced, which means the cost of delivery is high, the cost of maintenance is very high, which means most of our focus will be drained into finding a drug that can cure. While that's important, that's not going to really take away the problem, because you will still have the problem which is sustained in the population. I'll just give a simple example. Most of us would like to believe that diabetes and obesity is something that happens after you reach a particular age. I don't know, many of us will know that this is largely caused because of nutritional deficiencies that can be tracked as early as in pre-pregnancy, during pregnancy, in early childhood. You need to create awareness, you need to create research platforms that will tackle the entire life cycle of an individual and of population belonging to different socioeconomic strata, because the lifestyle is not something that is commonly acceptable for all of the people. So you have very different people having very different lifestyle issues. So here, therefore, putting pharma and academicians at the center of problem solving will not be useful, because prevention is not very economically appealing, neither is it appealing from a getting visibility perspective. So therefore, governments should take a leading role in doing this. But having said that, opportunities like this and clinics like IDEA could also play a big role. And for example, again, we've initiated a mega program on malnutrition and double burden, because malnutrition in young age seems to be the biggest driver of all of these diseases that we're talking about in middle age and late life. There is a little effort that has happened. Our public health initiatives have been largely deprived of data, which we have already talked about, and the crosstalk between clinicians and academicians. I believe more such dialogues where we bring in the stakeholders should happen. And I would probably take this as an opportunity to say probably academicians should reach out to the clinicians. The reason is clinicians are always busy solving the problem. As somebody said, the burden of treating the disease is high. The patient to doctor ratios are very skewed in India. So you can't expect probably the doctors to reach out to the academicians to help. Probably academicians too should take the first step to reach out to the doctors to say, can we help solve the problem? That's my view. Thanks.
Thank you, sir. Professor Subnarayan Rath, would you like to add something?
Yeah, actually, I would like to add something. Rather, I would differ in many of these other person's opinion because I am mostly a doctor, so my points will come that way. So let me talk about the example when this pandemic started. So at that time, almost all academic institutes suddenly closed. Everybody is asked to vacate, and I'm sorry if it hurts somebody. I will say most of the academic institutions almost did nothing except lockdown in their houses. At the same time, as my all the doctor friends I know, they are not only working, they are overworking. And sadly, I'm saying some of my senior and juniors of my age, they actually are dead now because they are doing this service. Okay. So then coming back to that time, I feel, again, differing from the other opinion, the stakeholders cannot be only one person. By rule, stakeholders, whoever involved, they have to be involved there. So whether it is research innovation happening or in the prior comment about the only patient is the stakeholder, I must say everybody must be brought to the table and everybody's opinion matters. Because by rule, the doctors cannot just do the service and they have to know also their comfort and their way of giving services. So coming back to the innovation and research point, what I say, in many foreign countries where I worked, actually the doctors are given the main PI role because they know it is ultimately going to be applied and they kind of decided everything. Rather, in many countries like Germany, the entry point doctors actually fee and everything and their salary, everything is more because they are given the due respect and responsibility. So coming back to the Indian scenario, this is actually I know lacking because doctors are really overworking here. Our doctor-patient ratio is very low and they are really overworking here. So luckily, as a clinician turned researcher, I joined here. I actually try my best to reach out to doctors and I get the best idea, innovative things from them actually. Really great idea. So I think in this time it taught us, instead of thinking the doctors will reach us, we should go out to reach the doctor. And until that situation come and which is coming very soon, where the hospital and engineering or the research institute should be together. That means no need to reach out under the same table. We can sit and discuss and plan things if possible. So again, to make this all things understood, I will tell. I have gone to one high school in University of Tokyo. So there, we are supposed to do innovate in many things. So the first thing they asked us, even as a faculty, to go to field visit. So we want to innovate, let us say for some mall. They asked us to go to mall, find all the problems and then get the solutions there. So in that way, I personally feel any medical innovation, we academicians need to go to hospital, take the advice, suggestions from the doctors, and we have to follow as per their timings available. Actually, they are not easily available also, I agree, they are overworking. And then only the innovations will start. Until that happens, India will still depend on foreign countries to import stuff. I personally believe that.
No, I don't think we differed. I think we said the same thing. I think doctors are busy, doctors are saving lives. Academicians should take the burden to reach out to the clinicians. And it's not going to be an easy route. Again, something that I've done, I walked this path. You have to constantly go to the doctors, talk to them, and let them define the problem. Often, academicians define the problem, and it's quite likely that's far from reality of what's happening in the clinics. So it's always good for the clinicians to define the problem, and the academicians come with a solution. And that's what we are doing actually. So we've been to rural hospitals, community health development centers, as remote as in parts of Tamil Nadu, in many other, even Northeast countries, Northeast states. Going there, you will realize what the real issues are, and talking to the doctors, you will know what the solutions are useful for them to even have a translatability. Otherwise, we sit in silos and we talk about what is translation, what is digital health, that may not be able to solve the problem because it's not reaching to whom it matters. So I think academicians should take the burden of reaching out to the doctors. And the last thing is, there should be programs even within clinics like IDEA, where probably you allow your doctors to also spend time in an academician's lab, or allow academic students to spend time in your clinics. Unless we cross that bridge, I think we'll always remain on two sides of the table. We talk about solving problems, but I don't think anything is going to come out of it.
Fully agreed. Thank you.
Yeah, very nice point made. In fact, it is the doctor who looks at the patient and finds the issues. Those issues should be brought to the researchers and the academicians. Sitting in their lab, they will find out what would be the solution. Because it is their full-time job of researchers. I would utilize this forum to read today's editorial, 16th July in Lancet. And it entitles that Measuring the Future of Humanity for Health. This is the editorial, Lancet, volume 400, July 16, 2022. The notion here is that reduce the burden of nation, stay healthy. How do we stay healthy? Unless and until we take care of basic cause of the unhealthiness. I pick up few points that estimating the future is fraught with uncertainty. In the league table of nation, India will pass China as most populous country in 2023. Although the global life expectancy continues to increase, large inequalities exist, as one gentleman inquired, poor people seeking the health and the richer people getting through that one. The percentage of people ages 65 year and older is expected to increase to 16% in 2050 from 10% in 2022. The countries are experiencing sharp increases in working age population in coming year. From the planetary health perspective, the relationship and relation and the geography of humanity and migration shift will inevitably take place during future decades, will influence urban food and health system in transformative way. We are seeing very often that migration from villages to the cities are increasing. And that is not only increasing the number of population in urban cities, but that is becoming burden to the healthcare and other systems also. How do we stop the migration and and provide facilities and employment education there itself. Unless until we take care of these things, nothing is going to happen. Everybody, I am a stakeholder of my health. My stakeholder is not somebody else. I have to take care of myself. And this is one has to have realize the responsibility of oneself. And these four, they now say that these forces shaping human movements across the globe are inevitable and must be embraced and managed, not dismissed or resisted. The voice of an independent union that represents the interest of people, not politician, has never been more important. The very important point in this editorial is that how we are going to provide healthy food to the people. Because when minister was also saying his experience, I am very poor, I do not understand, but I can sense the language that in his busy hours, the cheapest food are sugar-rich food. The nutrient depleted food are the cheapest food now available to the people, and they have penetrated even the tribal belts, and at the cheaper price. Healthy food and nutrient dense food are becoming very costly. How do we expect health when we do not have a healthy food? We have to meet these requirements at every level and work towards this. Provide, in fact, technology is very important. Where our kitchens are vanishing from our homes and we are looking for ready-made food. See, how do you think that Swiggy and Zomato will be providing you a very healthy food? You don't see the kitchen, you don't know who is making that, in which condition it is being made. Food, in Taitri Upanishad slok I recite, that Jatan annena vardhante, जातान अन्नाद भूतानि जायन्ते जातान अन्नेन वर्धन्ते अन्नम ही भूतानाम ज्येष्ठम तस्मात् सर्व औषधि उच्यते. We are born, we live, we survive, we grow and we die consuming food. You have every gadget in your house, you don't have food. Do you think can you survive? Food is the first medicine, and that food should be healthy. Chandogya Upanishad says, Ahara Suddho Sattva Suddho Dhruva Smriti Smriti Lambe Sarva Granthi Nam Vipramokshas Tasmai. If our food is healthy, is nutritious, it is rich with all the micronutrient, vitamins and minerals, and what are so many phytochemicals. We are hardly going to develop these lifestyle related disease. First, our emphasis should be provide healthy food. Rest will be taken care. Burden on the nation and the clinic will get reduced and society will become healthy. I am happy to announce here that one of our partner, Dr. N.S.D. Prasad Rao is here. And I am glad to announce that so many of my research in the laboratory has got translated into the clinic in a positive way, and we are in the process of making products out of that one. And there is a need of people coming out from their clinic and doctors associating with the biomedical researchers, where indigenous research can be translated into the clinic, and ultimately if things are translated into the clinic, there are people, they will make the product, and we will move forward towards making a healthy society. Absolutely, there is no doubt. Thank you.
Thank you, sir. That was a very interesting answer. So, moving to the next topic, As we know, a healthcare institution can be private or governmental owned. So, Mr. Rajesh Manthena, sir, in your opinion, which healthcare entity do you think is better for patients and for doctors?
A tricky question. I'm not going to say, which is better, but let's talk about, what happens today, right? In terms of, who amongst us has actually went to a government institute for health? It's a simple question to answer. I mean, I don't remember going to a government hospital the last time. Neither I would expect that, the same would be the answer from most of us. Having said that, it's a large problem to solve. I mean that answer because we're sitting in Hyderabad, comfortably. If we were to be sitting in a tier 3, tier 4 city, in a Bihar or UP and Telangana in a Tanda somewhere, the answer would be different. But it's a large problem to solve. I think both private and governments have a big role to play. As the health minister Harish Rao Garu expressed, the government I think is doing their part, but again, education is key. If medicine that is delivered at a doorstep, right, by the government is only being consumed at a 35-40% rate, right, then that kind of is a sort of microcosm of what the condition today is, right? It is in education, it is in early detection, it is in making sure that the right kind of training happens at the paramedical level, because it's all sort of falls on the doctors today. But if you go down a level, right, are the nurses trained properly? Are the paramedical staff trained properly? A lot of things to do. Primary health is something easy where the government can actually get involved, which I think they are trying to solve. Education is something where government can solve. So I think it's a mixture of both. But today, a large portion, or at least on the secondary and tertiary care, it falls on the private players. Yeah, that's the answer.
Thank you, sir.
Actually, I was waiting for a point to be made in the previous discussion also and here also. It is going to be short, 30 seconds. For my previous this thing that research, academicians, medical colleges and all. So I have a lot of experience in doing the technology solutions research. And as a part of that, we have actually tested a jet injector on an audience there. And we found that the stakeholder, the beneficiary, and the researcher, everyone has to actually come together only to make a logical conclusion, to give a meaningful solution to the last point end user and the person who is going to use that. So it's very important that everyone comes together, and who has to approach and all these things. I feel all three together have to sit together and actually get these things done. So jet injector example I wanted to give because we tried this on small little kids in one of the hospitals here, and the first prototype we tested was like a gun, like a pistol. And the moment the pistol was seen, the kids started screaming there. Then the moment we changed that gun into a small toy, it suddenly became very friendly to the kid. So what I'm trying to mention is that the end user, the beneficiary, and the person who is going to use is very important there. Similarly, another one more example I want to give is we tested some cutters, some needle cutters we tested, and we wanted to give a good maintenance to that needle cutter so that the cutters last a long life. And so we advised all our healthcare workers to actually lubricate those two drums properly every month. And when we went as a part of research to individual institutions, a few of the institutions were not doing well. The drums were just jammed. And when we went to some other institutions there, they were perfectly functioning. One of them was perfectly functioning. And so then we asked, how is it working here and why it's not working there? So she said, the worker said, if you don't scold us, we will tell you a solution for this. So I said, what is it?
Sir, everyone complains that there is no oil available within the primary health centers. Who will get the coconut oil from home and then who will do this? So then she said, I have found a solution. I just picked up a condom packet, put it on my finger, I just lubricated the drum and it's perfectly working. So what I'm trying to say is any formative research, any research, the final person who is going to implement that, the solution lies there. We need to really work out with them very closely to really find those solutions out. So I would say equal partnership by everyone, whether it's academician, whether it's a person who is taking research or the stakeholder, everyone should participate. And the second, second example, like she asked the question like where will you go, whether you will go to a private or government. It depends upon the services which we are satisfied. Like all my children I have taken to the government institutions for immunization. I have purposely avoided the pediatricians, the private practitioners, because the cold chain system in the government system is the perfect cold chain system. And there is a lot of investment which has gone in the cold chain system. We have personally trained all this, so we were very confident that the immunization, the quality of vaccine which is being received by the kids is the best in the government. So I would say I would go to the government. If I get TB, where will I go? I will definitely go to a government institution because there are very good protocols set in. There is a lot of investment which has gone in. There's a good quality drugs which are provided there. So I would prefer to really go there. So it all depends upon the confidence of the people on the system. Where would I get a best service? Best service plus quality. It is just not the lip service, talking good and not giving a good service. It is service, quality, everything put together will really matter. So whether it is government or whether it is, we need to concentrate on quality, good services, and also the patient satisfaction matters here. Thank you.
Okay, so I think we're running a little short on time. So if we keep it brief, maybe we can accommodate a couple more questions. So basically, from multiple research papers, we have seen that, and also just general knowledge, you can see that an increase in life expectancy can result in a multifold increase in total GDP. So how would you say that healthcare industry can play a role in the country's GDP? Professor Vijayasundar, if you could answer that.
I mean, we can look into healthcare sector from an economic standpoint at two levels, right? At a macroeconomic level, the question is more towards the macroeconomic level. So first, let me address that. So today, if we see the healthcare sector is one of the largest contributors of Indian economy, right? It is growing at a compound annual growth rate of about 22%. We are talking about an industry which is 375 billion US dollars. That is healthcare industry in India today. There are so many factors, economic factors, which can add or disrupt this equation which we are talking today, because we are in the world where it is constantly changing at a higher pace and momentum, right? So firstly, looking at the aged population in our country, it is about 8.6% of our overall Indian population is the aging population. But I won't mean to say that it is because of the aging population the economics is disrupted, because if we see other countries like Japan or Italy, they have more than 20% of Japan's population is aging population. But still they are a developed economy, right? But it could be a factor, is what I'm trying to say, number one. Number two, we are getting into an age where the public-private partnerships in healthcare are growing at a tremendous level. Number two. Thirdly, we are also witnessing what is called the digital interventions in healthcare, which also can disrupt the equation of what economy contribution by healthcare can add value there, right? Number three. And number four, again, the growing middle class population leading to many lifestyle diseases. Now, as some of our friends here spoke about, how can we focus on preventive healthcare starting from the food and lifestyle itself? Even those aspects would have an impact on the overall macroeconomic contribution by the healthcare industry. But all of these are at a macroeconomic level. But if we put this question, squeeze it into a microeconomic level, at a healthcare organizational level, at a hospital level, today the buzzword is digital. And I'm not a big fan of digital, neither I am trying to say digital doesn't work. But some of my research work specific to digital health at microeconomic level says that 70% of digital interventions, the investments which go via hospitals on digital fronts fail. 70% of digital investments fail. Now, this has an impact on the microeconomics of a hospital. How? Number one, it is going to put the investment and we try to see the results immediately, which is not going to happen in an industry like a healthcare, because we talk about things like the digital profiling. Today, the Honorable Minister spoke about the pilot of digital profiling in a couple of districts in Telangana. Now, putting an investment of that kind will not reap a result immediately, because we are talking about gathering data about people, which has to be a mammoth activity to perform. Now, the efforts and the investments which go into this will reap the economic benefit only in a mid-term, not immediate on a short-term basis. Now, this is the digital myopia which most of the healthcare administrators today are living with. That I put money on digital, what is my ROI on it? The ROI will not translate into a readily seen economics immediately. It's not going to happen overnight, because there is a lot of change management which has to happen at 3 layers. And as one of our friends just mentioned to as a response to other question, it all boils down to patient centricity. On patient centricity layer lies the process layer, and on the process layer lies the technology layer. Now, if we don't respect the patient centricity layer, if we don't respect the process layer, and the focus and the investment goes into the digital interventions alone, it's not going to reap the benefit. And this is the trap of digital myopia, which is impacting the microeconomics of hospitals, right? So I tried to answer your question both from a macroeconomic perspective and microeconomics, but open to any other thoughts from others.
Yeah, that was a good insight. Thank you.